So I think we can start now, actually. So good afternoon, everyone, or good morning, good evening, depending on where you are. Welcome to today's webinar, where we will be taking stock at the one-year mark of what is an unprecedented wave of social protection responses to the COVID-19 crisis, reflecting on emerging lessons for the crisis response and implications for future social protection. My name is Ralf Rademacher. I'm the head of the Global Alliances for Social Protection at GiZ, and I will be moderating today's discussion. So 1 year from the first announcement of lockdown measures to contain COVID-19, we are asking two sets of questions. The first set is the following. So how well have social protection adjustments and measures taken since the onset of the crisis performed in delivering support to affected groups? What are emerging lessons for delivering timely and adequate social protection in times of crisis and for the strengthening of adaptive social protection and preparedness for future crises? The second set of questions is the following. Is this right now a turning point for social protection, as some have claimed? Is it an opportunity to address the gaps and inequities in existing social protection systems on a more permanent basis? And if so, what are the policy priorities for governments and partners moving forward to help enhance social protection systems? We'll have a fantastic lineup of speakers today to help think through these questions. So we will be hearing from the emerging findings from an ongoing ODI-GiZ project on social protection responses to COVID-19 and beyond, lessons for adaptive social protection in future crises. And from the experience of government official, civil society, and researchers. First, Francesca Bastagli, who is the director of the Equity and Social Policy Program at ODI and also the project lead of the ODI-led and GiZ BMZ financed study, will present the emerging findings from that study. Following Francesca's presentation, we will hear from a panel of distinguished speakers. First, Bessie Msusa, who is the chief economist in the Poverty Reduction and Social Protection Division at the Ministry of Economic Planning, Development and Public Sector Reforms in Malawi. She will be offering valuable insights from the policy-making perspective, including on financing, and having worked for several years on adaptive social protection and system strengthening in Malawi. Thereafter, we'll hear from Dr. Sania Nishtar, who will bring complementary policymaking viewpoints from Pakistan, based on her work overseeing large-scale social protection program delivery during and prior to COVID-19, as the special assistant of the Prime Minister of Pakistan on poverty alleviation and social protection. After that, we'll move on to Lynette Mart, who will offer reflections as the National Director of Black Sash, a leading South African civil society organization that works on the advancement of socioeconomic rights and access to social protection, with a particular focus on the most vulnerable. And thereafter, Ugo Gentilini, the global lead for social assistance at the World Bank, will also share some thoughts. As many of you know, Ugo led a mammoth global effort to track and analyze the adoption of social protection systems worldwide in response to the pandemic. And last but not least, Professor Armando Barrientos, Emeritus Professor of Poverty and Social Justice at the Global Development Institute at the University of Manchester, will share his thoughts. He has long-standing expertise and published on many aspects of social protection across low and middle-income countries. So after hearing initial remarks and responses to the ODI study from each of our esteemed speakers, we'll move to a group discussion, and we'll be taking questions also from the audience. You should see a Q&A box in your Zoom interface. Ideally, use that box to post your questions, not the chat box. And you can post these questions already as we move along in the discussion. If you're on Twitter, we'll be using some hashtags. It's the #sb.org webinar. It's will also be shared by the colleagues here. And for this event, and we are posting these and some Twitter handles in the chat box now. So with that, and without any further ado, I'd like to now welcome Francesca and ask her to kick us off with her presentation. Francesca, over to you.
Thank you very much, Ralph. So I have a few slides to share. I think hopefully you're seeing them. They'll be shared centrally. Karini, I think we can, if you can move down on into the first 2 slides. Yeah, thank you so much. So I'm going to be presenting an overview of an ongoing ODI-GiZ study that Ralph has already described, looking at indeed at social protection measures taken since the onset of the crisis, and thinking a bit into, moving a bit into the already beyond space, sort of medium longer term thinking around what are some of the emerging lessons and implications moving forward. If you could please move to the next slide. Thank you. So we have, so the research project has essentially 4 core questions. One of them is to look into what do we know about the implementation of COVID responses in practice, or anyway, since the onset of the crisis in practice, moving beyond some of the commitments or announcement made, what has been delivered, and related to that, what do we know about how effective these adjustments have been, particularly in terms of crisis response, how timely have they been, how adequate have they been, and in particular for population groups that we know have been adversely affected by the crisis, but that also tend to be traditionally, in most contexts, also disproportionately excluded from existing social protection schemes. And these are specifically, as you'll see in a minute, informal workers, women, urban households or urban residents, refugees, and those are the 4 focus groups that we're covering. We also want to understand better, related to the effectiveness question, what are the factors that are enabling or conversely hindering effective, timely and adequate response. The third set of questions is moving into sort of forward-looking question of, given that the crisis has exposed existing gaps and inequities in social protection measures and systems, what is the emerging evidence or even thinking around whether and the extent to which some of the measures adopted in crisis response mode hold potential for addressing these gaps in the longer term. And finally, a key objective of this project is to identify emerging policy lessons, both in terms of better preparedness for future crises and adaptive social protection, but also for strengthening social protection more broadly moving forward. If you could please move to the next slide. Thank you. So the project has 7 primary outputs. These are papers, as I said, one on informal workers, one on women, urban sector, urban context, refugees. We have then 2 cross-cutting themes, so financing with a focus on the role of international assistance, ODA, and then an operations-specific paper looking at issues of implementation and delivery. There's then an overarching framing and synthesis paper. You'll see here in the table also the list of experts, esteemed colleagues from ODI, but also beyond, that are contributing to this effort. And just to mention that in terms of approach, so the case, we're essentially reviewing existing evidence from a host of sources, and then also diving more in depth into specific case studies that are specific to either measures, adjustments that were adopted, or to sort of country level case studies. All of this to say that this study, the objective of this study is to complement some of the ongoing efforts around that are doing more comprehensive monitoring of adjustments and their evolution over time. This is really taking more of a deep dive into the specifics of what are some of the enablers, what are some of the bottlenecks, what are we learning, and what are the implications moving forward. Just to give an update on the status of all of this, this is work that is still underway. So 4 of the papers are complete, undergoing production. 3 are in final draft form, but the plan is to release them over the course of well, May and June. There will also be a series of podcasts that I'm sure we'll come back to at the end of this conversation. But really for today, the sense that from my perspective, I will aim to give you some top line thinking or findings, emerging findings from this study with the view of getting some feedback and stimulating some conversation while this work is still underway. If we could please see the next slide. So a quick overview of the framing of the piece of the entire project. We take into account a range of social protection measures ranging from and adjustments since the onset of the crisis, ranging from what are often labeled as automatic stabilizers, including, say, contributory insurance type schemes that are, at least in principle, designed to expand as demand expands. But also consider program or policy adjustments that require, more proactive, explicit adjustment. Many of these, of course, temporary or short-term. New measures that have been, set up, again, many of these on a temporary, short-term basis, but to varying degrees independently of existing schemes. We also explore social protection links and efforts to strengthen links with social services, with labor market initiatives, and importantly, explore the humanitarian social protection links. So the project includes a paper by Jessica Hagen-Zanker and Natalie Bott with a focus on refugees that examines this in great depth. The 2 sets of outcomes, just a quick word to say that in this presentation, I'm going to focus, I will not be covering all of this, I'll be focusing on income support schemes, in part because de facto the population groups we're looking at, income support has played a big role, particularly in the first phase of since the onset of the crisis and crisis response. But the reports will look in more depth across these measures. The outcomes we're interested in, as we've said, and this is very much the way in which today's conversation is framed, is across 2 sets of outcomes. On the one hand, as we've said, we're interested in understanding what is the evidence around how well these adjustments are performing from the perspective of crisis response. And we're looking out for the classic criteria that we look for in sort of analyzing or even assessing response performance around timeliness, how quickly were the adjustments made, issues of coverage, are we seeing expansion, which groups continue to be left out, and so on. Adequacy from a value or level of the transfer issue, and then other adequacy concerns, including the type of provision provided, comprehensiveness. Again, today I will barely touch the surface around issues of timeliness, coverage, and value adequacy. The second set of outcomes is around whether or not there's a sense that there is either actual evidence or a sense of potential for these adjustments made since the onset of the crisis to, as we've said, to actually address the gaps and inequities in existing programming and systems into the medium to long term. We particularly, the focus is on understanding what are the enablers and bottlenecks, and particularly we want to extract information and learning around what is it that works or doesn't work when it comes to policy design, implementation, financing critically. And throughout, of course, we pay attention to both how individual or household level factors, variations by gender, legal citizenship status, work status. There's a whole paper by Laura Alfers on informal workers, variations by age and so on. And then also the meso-macro picture, developments at the political level, institutions, labor markets, geography, and so on. So this gives you the overarching framework. Next slide, please. So crisis response effectiveness. I'm really just going to touch upon, give some top line thoughts. In all of this, just to say that I am really going to be giving an overview of some of the issues that are emerging and some of the also questions that are emerging, as opposed to the policy recommendations. The reports actually contain some fairly specific policy recommendations, but in some sense, I thought that would be less, interesting to just list, recommendations emerging. You'll find these in the reports. Here, just an overview of the sorts of issues that are being raised and where the questions also remain. So on timeliness, we check timeliness against when the lockdowns were announced, against when announcements of adjustments were made, and then delivery in practice across a host of different interventions. A range of factors determine timeliness. One of the factors that matters, of course, is whether the adjustments are to existing schemes versus the introduction of new schemes. In some cases, not always, there is, timeliness is associated with reliance on existing schemes. Again, this is not always the case, but there can be an element of automatism, so to say, where expansion is quicker, where schemes are already in place. Also, a sort of general trend, and this is fairly straight, evident, but confirmed by what we're seeing across the groups that we're looking at and across countries, is that those that were already undercovered or poorly served by existing pre-crisis social protection were also less likely to receive timely response. And an example, very brief one, South Africa, where you see very clearly an immediate or close to immediate automatic almost expansion of the contributory side of the social protection system, so reaching out to formal sector employees and employers, the expansion, the top-ups to the social assistance scheme happening 1 month into the announced lockdown, and then the emergency cash transfer triggered further down in the summer. And if you if you don't mind showing the next slide, this gives you an example, the timeline of where we're looking. This is purely descriptive, by the way. I mean, this is just, we're plotting across, the countries we're looking at and specific case studies, just to give an indication of the range of ways in which there were the duration across, when the crisis was announced, let's say lockdowns announced, adjustments to policy announced, and then implementation in practice, how they vary, and some of the factors that determine that. Can we go back to the previous slide, please? As you know, and as you might imagine, we see that critical factors are the maturity and nature of pre-existing infrastructure that is critical to determining the timeliness of response, which is so critical in a crisis situation like this one. And across the board, whether for informal workers, urban dwellers, households, refugees, the availability of information on these subgroups in information registries or in social registries of various type facilitated timely response, even if they were not yet recipients, where there was already some degree of inclusion of information on these population groups that does facilitate timely expansion. And there's a range of examples of how we are seeing quite impressive again, adjustments that have helped to expand coverage to these groups. Even where these weren't in place, very interesting and rich range of examples of efforts that were put in place to include and step up timely response. This often involves new technologies, strong relationships between government and various partners, including civil society, and efforts to promote awareness raising among potential recipients. And again, many examples from Pakistan, Jordan, India, and so forth. On coverage, very quickly moving on to coverage, factors that we review, classic, efforts to expand coverage by adjusting eligibility rules. Important examples both on the contributory and social assistance side. Many of these are temporary, but still, at a minimum have succeeded in some countries in expanding quite noticeably coverage to the groups that we're reviewing. Similarly, around, if we look at new schemes, again, many at most of these, the ones we're reviewing, temporary, but still a wide range of examples of how new schemes are adjusting to expand and are, but we'll come back to some of the details, but are expanding coverage. using quite different approaches. In some cases, these new schemes are quite narrowly extending coverage to very specific population subgroups, like to particular urban centers or even subpopulations within these urban centers. In others, they're essentially going for more of a blanket, large scale. If you think of the Brazil's Auxílio Emergencial, that is covering a third of the population of Brazil, 70 million households, so paid out to try and cover a range of people affected.
Francesca, keep an eye on the time, please.
Oh no, okay, goodness. So I'll really have to fly through this then. Administrative simplification efforts, again, to expand coverage, and a lot around also promoting the awareness of entitlements, particularly around excluded groups, and communication efforts have been key to expanding the coverage. We examine at length also the value of transfers and their adequacy. Clear patterns emerging. Some of the emergency short-term transfers are commonly of higher value than the existing pre-crisis ones that provide some indications also of sort of longer-term implications. Important ways in which the level of the transfers vary depending on how, of course, governments are trying to meet competing objectives, the classic coverage value trade-off that the governments are facing. The question of taking variations in need into account, and there are a lot of examples, hopefully this will come out also in the discussion, on the extent to which the level of the transfers are doing that, and that then determines the adequacy for particular subgroups of the population. So just quickly moving on to the longer term, so moving into, what does this mean? A key point is that, to be clear, in many cases, the adjustments we're seeing were not just crisis response, were also part of existing trends, national social protection plans that were being, had been adopted and were being implemented. So just to say that in some cases, we're seeing some degree of continuity and or acceleration in order to address some of the gaps. In others, there may be, yes, an opportunity for this to signal an actual turning point. And again, happy to give some examples when we come to the discussion. In terms, we look at a number of criteria. So sorry if you can move down the slide, Karini. So on embeddedness, so these are dimensions that can give some indication of whether and the extent to which these what are mostly, in many cases, short-term adjustments are contributing to actual medium, longer-term system and policy strengthening. And just to say that, again, we review, there are variations depending on whether adjustments are made to existing policies, to new policies, with regards to their embeddedness, that could suggest that there's potential for the schemes to give a more, to bring more permanent inclusion of previously excluded groups. We then look at also the potential to address coverage and adequacy gaps in the longer term, considering some of the classic barriers to adequacy. So for instance, attitudes, perceptions, and shifting narratives, but also other barriers associated with information gaps and invisibility, knowledge, lack of knowledge among potential recipients. And here again, mixed findings in terms of, for instance, perceptions and attitudes. We are seeing, the responses in some contexts are promoting a rethinking of issues of, where vulnerability sits and issues of deservingness. If we think of informal workers, urban contexts, in many countries, these were groups that were considered to be not requiring social assistance and explicitly excluded from certain forms of social protection. Certainly the crisis and crisis response has highlighted that actually they can be very vulnerable, that they do require some form of social protection. So the crisis response seems to be triggering a potential shift in attitudes and perceptions there. From an information perspective, again, many rich examples of how information gaps are being partly addressed or filled. And while this doesn't necessarily, again, translate into a permanent, filling of inequities, it can be a very useful tool. So then and then we look then later also at implementation and administrative capacity, it really could support a more inclusive social protection systems moving forward. And then also important a sense of the knowledge of schemes improving among population groups that might not have been aware of them, including on contributory social protection groups, including informal workers, but also refugees that might have been eligible but weren't entering. In some countries, Jordan and others, important examples of them being included, partly because they're now more aware also of their entitlements and of the feasibility of even of these programs. On implementation and delivery capacity, I've mentioned a few issues already. Some examples of where, yes, certainly, there are important lessons to be learned. The question is, to what degree will they be institutionalized moving forward in order to help ensure that that programs and systems are addressing some of the inequities that were already there that need to be addressed. Again, very promising around issues of information and data and coverage extension to excluded groups. Lots of learning around the tweaking or adjustment of eligibility criteria to be more inclusive, around delivery systems, and so forth. On financing, okay, that's another key question that is also key to this longer term picture. Whether any of this will be institutionalized or adopted in a more permanent fashion critically hinges on financing. And one of the reasons why we suspect we're not seeing more longer term, of course, commitments is precisely this, the uncertainty around the financing picture and the need to still, in many contexts, to identify sustainable financing mechanisms. Just to say that, at a minimum, so we are seeing a range of ways in which governments are turning to financing solutions in the short term. They're also facing major trade-offs, and some of these trade-offs that they face in the short term, and I'm thinking also of the contributory side of things, where, for instance, reductions in the contribution rates in some countries, which has enabled expansion of registration of informal workers and informal enterprises, actually has also gone hand in hand in some contexts with the depletion of insurance funds or reductions in pension payments. So those kind of trade-offs that we were already seeing in the short term are becoming stronger, and we will be facing them more and more as we move forward. At the same time, really important debates and thinking around alternatives for financing, including important initiatives around the potential to introducing solidarity taxes, wealth tax, or at least a one-off wealth tax, and other concrete and innovative financing opportunities. And finally, very final comment on the social contract, with apologies that I'm taking too long.
Brief one.
Yep. Yeah, a brief one. I mean, so the crisis has increased poverty and within country inequality, although, as we, the evidence is showing very clearly how the expansion of some of these transfers is containing some of that. But the truth is, we are seeing a very profound and negative impact. It has raised the profile of social protection, and a combination of these and the crisis response to date, or adjustments that have been made to date, are leading to, across the the studies that and countries we've been looking at, are leading to a combination of factors that you could point to a strengthening or establishment of a social contract in the form of, for instance, increased awareness, increased expectations, and increased demand for social protection, increased expectations around the role of government, but also around the role of employer in some countries, employers and international organizations are specific to social protection provision. And this can be, a key ingredient to promoting or strengthening a social contract. At the same time, we are also seeing the persistence of certain how can I say, attitudes towards particular groups that continue to be discriminated against, concerns about financial capacity de facto containing or constraining also political will to make longer term commitments that would really substantially affect the social contract. And so these are the questions that we need to think about as we consider the longer term implications of these adjustments. But keen to go into some of these points in the discussion. Thank you.
Super, which we will. Thank you very much, Francesca. And we all see that there would have been much more to say and to share. So all the studies will be coming out soon. So you will be able to read more details about it. So we move on to some reflections on that from our speakers, and I'll request each of you to stick to about 5 minutes each, and we will be starting with Bessie Msusa. Bessie, you've been working to strengthen the coordination and preparedness for shocks for a number of years now in Malawi. How do you assess the system's ability to respond to the COVID crisis from a financing perspective? So what has worked, what hasn't, what are the emerging lessons from Malawi for financing social protection crisis response, both for external financing initiatives and domestic ones?
Thank you, moderator. Can you hear me?
Yeah,
yes.
We can hear you well. Yes.
Yeah, okay, all right. So in terms of responding to the crisis for Malawi, what we did after the president declared an emergency, we developed a master plan. Apart from the usual COVID response master plan, which was coordinated by DODMA, but under social protection, we developed a master plan, trying now to expand the social protection system in Malawi. At the moment, we only had the rural social cash transfer, which under the master plan, we increased the transfers for 4 months. $4 per month. So that one was paid once off. But for the urban cash transfer, which was targeting the informal sector, in terms of financing, after the development of the master plan, we shared it with our development partners, and then the development partners were now looking into components and then choosing the components to finance. So in terms of coordinating and resource mobilization, that went well under the urban cash transfer program. The rural urban cash transfer, because it was already ongoing, we didn't have problems because the resources were already there. The partners which support us just channeled the resources to the already existing beneficiaries. That was the vertical expansion. But under the horizontal expansion, in terms of resource mobilization, there were no problem. But the execution now, because different donors had their own requirements in terms of contractual procedures. So that one has taken us long to implement the urban cash transfer. Suffice to say that apart from the targeting processes, but also when we wanted to start paying, it has taken us long because, we don't have a basket funding mechanism for social protection. So different donors were using their own procedures. For example, like the KfW and EU, they wanted a performance bond from our MNOs. This one also took long. While the World Bank, because they use government systems, that one was a low-hanging fruit because the resources were just channeled to the MNOs without all these contractual procedures. So in terms of financing, yes, what we have learned from that is that we need to have a system in place which will need to respond to the crisis. After the declaration of the pandemic, the pandemic in April 2020, we have not paid the beneficiaries. We didn't pay the beneficiaries until last month, February. Meanwhile, the informal sector was suffering because we targeted those who live from hand to mouth in terms of livelihoods. So that was the main criteria. What was the source of livelihood? And there were also an additional criteria. If a household had an elderly person in that one, in the household, and also if the household had the under 5. So that was the major criteria of selecting beneficiaries into the urban cash transfers. So in terms of adequacy, yes, because we used the minimum wage rate which was the 35,000 that time in 2020. So that was adequate because at the moment the minimum basket is 23,000. So in terms of adequacy, yes, but in terms of timeliness, we faced challenges because we didn't have the systems in place in terms of payment. Yes, I think I can stop there. Thank you.
Splendid. That was very exemplary also with regards to sticking to the time. Super. And a very interesting point you're making that obviously disaster funding and structuring that needs to be structured before the disaster or before a shock strikes. Otherwise, it takes too long to start structuring that, both domestically as well as international resources once the shock is there. We'll move on for a additional government perspective, and I'd like to turn to Dr. Nishtar. So, Dr. Nishtar, what social protection design and implementation features have enabled effective scale-up to affected population groups since the onset of the crisis in Pakistan? And maybe in addition, what learning is emerging for effective, timely, and adequate crisis preparedness and response?
Well, thank you very much for asking me to be part of this webinar. I'll try to be very quick and conform to your stipulated timeline. So to set the context, Pakistan is a very large country. We have a population of 200 million. And in this population, there are about 24 million breadwinners and their dependent families who either subsist on daily wages or earn piece rate remuneration or are employed, self-employed in Pakistan's very large informal economy. So there was a very large segment of the population that was affected when lockdowns were in effect. To respond to this challenge, the government of Pakistan created Asas Emergency Cash, which is the largest social protection program in the country's history. It was rolled out within 10 days of the lockdown to deliver one-time emergency assistance grants, and rupees 1.23 billion, 1.23 billion US dollars were allocated to support more than 17 million families, which covers around 109 million people. This is roughly 50% of the country's population. So it was a very large program. The name Asas comes from the government's new poverty alleviation framework, which was released a year prior to COVID-19, and it means compassion. In terms of the execution of Asas Emergency Cash, we used digital capabilities that we had developed in the past year. And there were three things which helped in particular. The first was a new biometric payment system. The second was a demand-side SMS-based request-seeking mechanism. And the third one was a new wealth profiling data analytics mechanism. So we combined all these three to provide emergency assistance, and we adopted a hybrid targeting approach, combining emergency assistance for the known vulnerable with demand-based assistance for the new poor. So roughly there were 4.5 million known vulnerable, so to speak, but the rest were all new poor. So the percentage of population which received first-time emergency assistance was fairly large. It was above 12 million. Now, in terms of execution, every Pakistani has a unique 13-digit national identity card number. So prior to the launch of this scheme, we heavily advertised and asked everyone needing help from the government to send their 13-digit national identity card number to an 8171 SMS short code. And this short code service and the campaign become widely known, by the name of 8171. In over 3 weeks, we received 139 million requests, of which 66 million were unique. We then used data analytics to ascertain eligibility using the national identity card numbers and drawing on survey data and wealth proxies. And the algorithms were structured in such a way that once the identity card numbers arrived, they were checked against many databases, and eligibility and regret messages were automatically sent out in real time. The wealth Proxies that we used were history of international travel, ownership of a car, income above a certain level as evidenced by tax agency records, average 6-month phone bills over a certain level, expensive processing of passports through executive centers, ownership of land, and government employees were also, and their families were also excluded. So those were that were eligible was sent messages the same day about their eligibility, and then they were put in a queue and dated messages were sent to them incrementally because we had to manage queues at payment site. We staggered payment messages. Every day a certain number of messages was sent out per union council, which is the smallest subnational level, and people would go and collect their payments at Grant sites. Now, all payments were biometrically verified. The system was end-to-end data-driven. It was fully automated. It was rule-based. It was transparent, and it was politically neutral. Now, we encountered a number of challenges during the disbursement process, but we tackled them in an evidence-based manner and by being very proactive with the communication. I'm looking at the watch, so I can't go into the details of the challenges that we encountered, but hopefully during the discourse, I'll have an opportunity to dwell on them. But the impact of this campaign was, and the intervention was truly humbling, because I met daily wage laborers without work for weeks, staff from busy hotels and restaurants, servants, part-time gardeners, security guards, industrial daily wages, fishermen, miners. There were transport contractors, hawkers, beauticians, barbers, shopkeepers. There were teachers, electricians, welders, painters, taxi drivers, car mechanics. I mean, I can go on and on. So the $75 that we gave them brought stability and comfort to millions of families, and the whole nation watched as millions of tragedies were averted. So we conducted a pulse telephonic survey when the operations were ongoing, and that survey showed that 97% of the beneficiaries utilized the full amount and 93% spent it on food. So if I just have another minute, I just want to explain that for Pakistan, this was quite a watershed moment, because I think to the extent of my ministry, it changed the way the government functions. It ushered in and fast-tracked digital transformation. It made the government more agile. It made us more data-driven, experimental, and ambitious. And in earnest, it helped with the fast-track adoption of cost-effective digital ways of working, which I think post-COVID have to be the norm. And most importantly, it also bolstered confidence in the government's ability to execute well at scale. And it really helped to further the citizens-government bond in terms of trust. Post-COVID, there's a broader policy conversation ongoing. We are revising our SR strategy on how social protection, the remit of social protection can be broadened even further to tackle poverty and inequity. And even whilst we were in the midst of the COVID crisis and executing SR's emergency cash, we did not let our new socioeconomic registry, work on our new socioeconomic registry slow down, because we knew how crucial it would be for expanding social protection post-COVID. And even in the midst of that crisis, our new health and nutrition conditional cash transfer program was on track, and we scaled up the education conditional cash transfer program. Because we know that these are very important instruments to fight the negative coping strategies, which are inevitable post-COVID. And just in the last 30 seconds, I would like to say that in terms of global experience sharing, the case of Pakistan provides a very useful lesson for other countries that utilize unique personal identification systems, because it has practically demonstrated to us that by combining cell phones, internet connectivity, unique national identity card numbers, and commercial payment systems, and leveraging the skills of public and private actors, a digital and an innovative demand-based social protection system can be created in a very short period of time. And we're very happy to use your forum to share experiences. There is a report which I've authored, very happy to share that with you, and very happy to engage in a conversation whenever you open the floor for questions. Thank you very much. Over back to you.
Thank you, Dr. Nishtar. Highly exciting case, I must say, and really underlining the usefulness of unique identifiers, of on-demand registration enabled through that, of communication, and as a result also the strengthened, government citizen relationships, which can come from, showing such a ability to deliver. So very, very interested to learn more. I'm very glad actually that German Development Corporation is currently discussing a project on supporting the social protection sector in Pakistan. So I hope we can absorb more information from there. We move on to.
I just want to say, in fact, my staff is meeting colleagues from GTZ tomorrow, so thank you for that.
Perfect. We now turn to Lynette Mart from South Africa, working for the civil society organization Black Sash. Lynette, Black Sash has been one of the most vocal organizations following the social protection system development in South Africa. What is your assessment of the crisis response effectiveness of measures which were taken in South Africa during the last year?
Thank you very, very much. I shall try to work through this quite quickly. Let me start by saying that the first thing is just to say that South Africa has there are two challenges for us. It's the most unequal country in the world. And prior to the pandemic in December 2019, Stats SA indicated that there's approximately 10.4 million people that were unemployed. And by December 2020, this figure had climbed to 11 million people if you use the broad definition. So that as the background, South Africa's growth also was minus 7.7. But let's just start with some of the basics. Prior to the pandemic, there were already about just under 18 million people already receiving grants, and those were old age pensions, disabilities, child support grants, and other smaller grants, but those are the three big ones, with an approximate budget of 170 billion rand on an annual basis. So by March 2020, when the South African government introduced the hard lockdown, what we call here level 5, there was serious curtailing of economic activities, and this resulted in a humanitarian crisis. And the initial response was government trying to distribute 1 million food parcels because it didn't really have a clear strategy and a policy for those between the ages of 18 to 59 who are unemployed or have little income. And this response was meant for the poor. There were complaints about politically connected people accessing food parcels, and there were long and snaky queues where private and faith-based organizations tried to initiate food parcels. But there were all sorts of complications about this also leading to the spread of the virus. And government realized very soon that it needed to change tack. And so there in April 2020, just 1 month after the announcement, government introduced the Unemployment Insurance Fund, TIRS, which would enable companies to distribute unemployment insurance benefits to workers who have lost their jobs on the pandemic. But the more interesting one is the one that government introduced various social relief of distress measures to try and stem the economic outfall with a budget of about 50 billion rand. And within a month, it introduced top-ups to the existing grants of 250 rand, excluding the child support grant. There was only one amount that was given. And after that, it introduced a caregiver's allowance of 500 rand. That terminated together with the grants, with the top-ups in October 2020. Now, government also introduced a new grant because it realized that there's a gap. I mean, organizations like the Black Sash and others have made it aware that constitutionally, it is not providing for those between the ages of 18 to 59. And in fact, there are recommendations from the United Nations International Covenant on Social and Cultural and Economic Rights. And so the question here was that particular grant for that cohort. It started off with all the other grants. It was supposed to end at October, but that was extended with another further 3 months ending in January. And in his State of the Nation address, Ramaphosa introduced that grant to be extended for a further 3 months. So in essence, that grant would have run for about an entire year. By the end of December, government released discussion papers on a basic income grant for the unemployed. The National Planning Commission also released a discussion paper on options for rollout. But the counterside to that was austere budget challenges 2021-2022. We can discuss that further. But just in terms of the COVID grant, now the COVID grant was introduced. It was an entirely mechanized process. It had various platforms for people to register, USSD, email, etc. A total of 9 million, just over 9 million people registered for the grant, but only 6 million received the grant. And that is an issue that we are taking up with government to understand this variance. Part of the variance have been the fact that it's online platform, the communication was only in English, there was no face-to-face contact. And this presented particular challenges for poor people in rural areas with no or limited access to devices, interconnectivity, or data. The problematic challenge of verifications that were done on a month-to-month basis against outdated various databases like the Unemployment Insurance Fund, the South African Revenue Services, and the Tertiary Bursary Scheme, NSFAS. People also had their bank accounts checked. And as a result, not everybody received these monthly payments on a month-to-month basis. So if you have 50 Rand in your account, you forfeit 350 Rand for this grant. The appeals process was problematic. It was introduced very late, 15 days into the process, and there's still ongoing challenges with the automation. Now, the Caregivers Grant was introduced. It stopped in October. There were several issues with the design of that particular grant. It was unclear whether it was for an individual adult or for the household. The unemployed adults, when the grant came to an end in October, couldn't apply for the COVID grant because it was assumed that they had already received another grant. And in this instance, for a child, it was not even on behalf of them. And so there's an issue of gender discrimination against about 7.1 million people, 2/3 of that, of whom are unemployed, who are not able to receive any form of support in their own right. And in fact, the NISCRAM data in the last quarter of 2020 indicated a decrease in food security and women and children going hungry. There was also challenges with the amount of the grant. It was between 350 Rand and 500 Rand. And everybody is saying that that's too little. It doesn't even cover the minimum food poverty line. And particularly in bigger households, those were felt quite badly. So yes, there was also one other challenge. The Scalabrini Institute took legal action against the state for the rights of asylum seekers and migrants with permits to access the COVID grant because they were locked in South Africa, they couldn't move. The challenges with that system was the 13-digit ID system, which applies for all other categories, couldn't work for this cohort. There was numerous challenges with vetting from the Department of Home Affairs. And so when we were meeting with SASSA quite recently, that people only started to receive grants from January and February this year, following the challenges with the automated design. So
Annette,
yes,
I would need to ask you to slowly wrap up.
okay, let me wrap up and say that this idea of a basic income grant or universal basic income grant has been in the South African context for from 2002 already. It's almost 20 years. The issue of political will was a serious challenge. But the COVID grant has actually, or the COVID pandemic has allowed the state and others to push for some kind of a grant, the basic income grant. Unlike in the past where we've asked for a universal one, this time we asked for social assistance so that people can meet their basic needs, and then working towards a universal basic income grant. And we will continue to advocate for such a grant to be in place very soon. Thank you.
Super, thank you. That was very interesting, a very interesting different perspective also, which you bring in. We now move to Ugo Gentilini. Ugo, you've published quite a lot of valuable analysis throughout the crisis, and taking stock of measures adapted and evidence of the effectiveness over this last 1 year. What, in your view, are the main emerging lessons for strengthening social protection crisis preparedness and response?
Well, thanks for having me, Ralph. Great to join this fantastic panel, and congratulations to Francesca and colleagues for their forthcoming paper. Will be a major global public good, and I really look forward to learn from it. So stepping back and looking at the past year, COVID-19 seems to me to have become kind of a great accelerator, an amplifier of pre-existing trends, all of which have big implications for social protection. And from this perspective, I see COVID sparking 4 main accelerations. The first acceleration concerns changes in labor markets. The 4 sectors most affected by COVID account for 40 to 70% of the workforce. More jobs are being automated as a result of the pandemic, with up to 25% more workers than previously estimated that may need to switch occupations, and informality is likely worsening. Research by Diego shows that in 10 out of 12 major cities around the world, over half of informal workers reported zero earnings, like we heard from Pakistan a few minutes ago. Hence, the more pervasive uncertainties and vulnerabilities in the labor market may strengthen the case for universal social protection, with a fascinating conversation on how that universality could look like in terms of program composition, the alternative trajectories to get there, and the trade-offs emerging in the process. And with COVID, we already saw 7 cases of universality in social assistance. So a lot to learn from those experiences. The second is an acceleration in policy convergence. People and institutions collaborate more when they are outside their comfort zone, and COVID-19 embodies a shock that is outside our comfort zone. As you said at the beginning, Ralph, we never dealt with a crisis of this type and magnitude in recent history. And in particular, I see convergence around 2 main policy issues. One includes the interactions between monetary and fiscal policy. The scale up of social protection is in most cases not financed by higher taxes, but by monetary expansion. And this means that countries have realized that they have multiple options for supporting vulnerable people directly. It can be fiscal policy, but also unconventional monetary policy. And either way, this conversation cements the role of cash transfers as a generator of economic multipliers, which range from 0.3 to 2.6 per dollar injected, and pivots into the discussion on the future of financing, as Francesca said, with perhaps more creative options than we had about a decade ago, for example. The other policy convergence relates to connecting social assistance and insurance. Cash transfers have de facto played the role of unemployment insurance for over 200 million informal sector workers. And now those programs are the backbone upon which other insurance interventions can be provided to those workers, including how states can co-finance worker contributions and facilitate access to innovative schemes and savings like in Ghana, Rwanda, and Tunisia. The third is an acceleration in the delivery frontier, particularly in urban areas. With the urbanization of poverty and the urbanization of crisis, I'm glad to see that there is now momentum for the urbanization of social protection. Our analysis of 11 countries in Africa, for instance, shows several innovations across the delivery chain and the use of big data deployed where there is little information on dwellers to start with, including in dynamic and informal settlements. However, we also see there is a lot of work needed to make social protection an integral part of city systems for infrastructure, jobs, and services. And cities also present ideological resistance to cash transfers in a few cases, including persistent skepticism around inducing dependency, attracting more people to overpopulated areas, etc. Finally, the fourth is an acceleration in the need for crisis preparedness. I guess we should think of COVID not as a typhoon with a precise pathway and compressed time frame, but more as an evolving drought with more uncertain, continuous, and lingering effects over time. So learning from the climate arena, one area that has high potential for improvement is the connection between early warning systems and social protection responses. Many decisions on coverage expansion are evidence-based, but the connection between diagnostics and response is not always systematic, and there is ample room for policy discretion. So moving forward, one way of having more objective, anticipatory, and adaptive responses is to better anchor the timing and magnitude of those responses to early warning systems that track, among others, pandemic risks. Thank you, Ralph, and I'll stop here.
That was 5 minutes exactly. So thanks for that, Ugo, and thanks for that excellent summary, which is very useful, and we'll come back to that if time permits. We move to our last but not least panelist speaker in that chain here, Professor Armando Barrientos. And I would like to ask you to focus on one specific element, basically taking stock at this 1 year mark. What is your assessment of social protection adjustments that have occurred during the pandemic, and to what extent do you expect these to result in longer term permanent shifts in social protection systems? So a bit building also on what Ugo already started pointing to.
Right. Thank you very much for the invitation to contribute to this panel. My remarks, given the time we have available, I'm going to focus on Latin America as a region. I'm sure it has been, it has been covered by Francesca in her presentation too. If you look at the region as a whole, there has been over the last 20 years sustained investment in social assistance, particularly in social pensions and conditional income transfers. That has got us to a point where perhaps between a quarter and a third of the population in the region can access transfers of this type. and where the institutionalization of these programs has advanced, hugely. So you have registers that allow you to map vulnerable populations. You have systems of adding interventions to the transfers that provide services too. And of course, in terms of evaluation and monitoring, that has been very effective. So you go to that point. And then on the other hand, if you look at social insurance, it's very kind of heterogeneous in the region, but countries in the southern cone in particular, the more developed ones, have had long-standing social insurance institutions that can reach a significant proportion of the population. So in a sense, Latin America was, from the perspective of social protection, in a good position to kind of adjust to the demands of COVID. And it has proved to be the case. Basically, the whole infrastructure and institutionalization has enabled governments to design and implement very quickly responses to the pandemic. I want to kind of pick on two things, just to give colleagues an idea of where the changes are taking place. The most significant change from my perspective, and particularly from the perspective of social assistance, is that governments have introduced short-term time-limited transfers to the populations who are either dependent on informal employment or have low incomes, but whose standards of living are not low enough for them to access the pre-existing social assistance programs. So there has been an extension of transfers to this sort of informal low-income population, and that has proved extremely useful. However, there are two buts. One of them is that the transfers are short-term. They have been introduced with the intention of their being short-term. So it's unlikely that they will remain further into the future. And on the other side, on not social insurance, but social protection for formal workers, I think I'm going to point out the countries that in the 1980s and 90s transformed their pension systems into individual retirement accounts. And they have proved extremely difficult and inflexible in trying to address the crisis, because mandated savings were very difficult for people to access them. And in fact, they require legislation, considerable opposition in governments and so on. So you can see what has been worked well and what has not worked well. Now, in terms of the future, and I think I just got 1 or 2 minutes, I'm slightly more cautious than Hugo. The Economic Commission for Latin America has called for Latin American countries to strengthen their welfare states and to invest in welfare states. We're not sure exactly what that means, but I mean, it sounds good to me. And they have also asked for a guaranteed minimum income equivalent to the poverty line. I think we have to make a very kind of clear distinction between the guaranteed minimum income, which is usually selected on the population that are more vulnerable, and a universal basic income, which it goes to everyone. What ECLAC has argued for is a guaranteed minimum income. So those are the two proposals on the table. But I'm cautious in trying to project these trends into the future. But I guess the message is it's much better to have social protection in facing the pandemic. Thank you.
Super. Thank you very much. And with the interventions of the last two, we've been also making that transition really looking forward. With the various valuable contributions, our time generally for discussion is cut slightly short. I'd like to nonetheless take a few questions nonetheless. So there are some very specific ones to the study, which I think have been answered by now, and also to the effect on informal sector. Francesca, are there any sources of social protection response financing that have, as you also do a study on the financing side, that have proven or can be imagined to be particularly relevant for the expansion of social protection beyond the COVID crisis? So we stick to the perspective.
That's the easy
beyond.
question. Yeah. So financing is the big question mark across the board. And yeah, I mean, well, so I mean, what's interesting is the options, and you know, we touched on this in relation to the study, and we will pick this up as well. I mean, already if we look at in the crisis response phase, a range of different options have been used, including domestically reallocating resources, additional indebtedness. There's been an important role for aid, particularly in low and low income countries. And the question is the question then is, in the medium longer term, what are the options? I think there are many options that build on some of the things that have already been done, and that may require some, how can I say, also some political courage. Some of these may not be too politically popular, but I think a crisis of this kind can sometimes, I mean, one of the potential game changers is that by creating disruption, there's a reconsideration of options that, you know, historically or in non-crisis times aren't considered viable, and often also politically. But we need to sort of think through their whole, you know, the different types. So for instance, from a social assistance, so if it's a question around maintaining revenue, or even raising additional revenue, I mean, there's a question around what are some of and these will vary by country, so it's hard to give a, you know, overarching single response, but they will, for some countries, and inevitably this will require a reliance on external assistance. And in fact, the specific financing paper that this project presents is on the role of external financing, and it makes a strong case for, you know, an urgent need to maintain or some countries even expand support to low-income countries to support social protection, and also discusses what some of those instruments might look like, and what aspects or elements of a social protection system that this external financing could support. That's absolutely crucial. There are then a range of internal revenue mechanisms as well that can be utilized. I think that one of the big questions is, of course, as we see economic slowdowns, and these are likely to increase moving forward, the kind of pressures on revenues are going to be increasingly felt. So where governments have relied on reallocation, in some cases, by the way, obviously one of the concerns is that there's reallocation away from one social protection program or social spending to another, you know, so concerns, but on the hand, governments have to make that call. There's a question of just maintaining at a minimum these levels of revenue that can be done by tapping resources that may not be taxed. As I say, you know, there are debates internally around, including in high income countries, around addressing issues that commonly are not that popular or not necessarily a priority: tax avoidance, tax evasion, and more. There's a big question mark around the contributory and tax financed balance of social protection, and here we have seen how there might be innovations in thinking through how contributory social protection can be maintained. We've seen in a number of countries, expansion of contributory social protection that in many ways was pre-crisis already a big question mark and an issue, and, you know, bringing in workers that are excluded and enterprises, firms that are excluded into the contributory mechanism. If this is where this has been achieved, how will this be maintained? We know that we're going to face additional pressures as unemployment rises, as the economic shock is felt. But even so, there are examples of ways in which the contributory side can be maintained, including with support by employers, by governments that might make things sustainable. So just to say, I mean, this is a really whirlwind review, but there are a range of options that can be considered. And importantly, I think the balance between contributory and non-contributory needs to be at the forefront, and the links between the two. So where in some countries there has been a steady also perhaps decline or withering of the contributory branch of social protection, I think the crisis in part reinforces the message that we will need both.
Super, thanks. We've addressed now particularly financing. We've addressed identification as one of the blocks. We've touched slightly upon payments. Let me pose one question with regards to coordination in such a shock response. Maybe Bessie, can you give us in few sentences learnings on the coordination for social protection in response of the shock as from Malawi? Bessie?
Yeah, thank you, coordinator. I think for Malawi, I think we have made strides in terms of coordination between humanitarian and the social protection mechanism. At the moment, we have a consultant on board looking at the coordination mechanism for social protection, trying to merge with the humanitarian sector. Under social protection, we are also working a scalable mechanism so that we scale up social cash transfer program in terms of a crisis. So we are looking at weather-related crisis, most specifically drought. If a drought hits, then we will need to top up the transfers for the social cash transfer beneficiaries. We are also under social support for resilient livelihood program. We are developing a contingency emergency response mechanism so that when a crisis comes, when a shock comes, we should be able to respond using that crisis emergency mechanism. So that's what we are doing at the moment. So in terms of coordination, we are doing very well in Malawi. Over.
Thank you. It seems we have just lost Sania Nishtar, to whom I wanted to get back on some of the challenges she mentioned and she was keen on elaborating on. The pity. As we are getting relatively short on time, I'll suggest we do a round of final statements where you can wrap up in a maximum of 2 minutes. And I ask you to really stick to that. Your key lessons learned and the perspective for the future, which you draw based on these lessons learned. And we'll do a round starting from Ugo first.
Thank you, Ralph. There were a few interesting questions in the chat as well. Let's see if there is time to respond for it. I would say that it's globally recognized that social protection is playing a major role in the pandemic. It is estimated that in the early days of the response, for instance, cash transfers and other programs saved over 165,000 lives. And there is a lot of progress in innovation, and we should collectively be proud of this. But as a community of practitioners, there are 2 risks that we should guard against, if you wish. One is complacency. I personally see the glass half full, but it's still half a glass. And as many have noted, the crisis revealed the holes in the system, and those holes are often large and deep. The other risk is somewhat group thinking. as I said in my remarks, learning and innovation sometimes occur when we are outside our comfort zone. And in this regard, I think we gather a richer perspective on our work by engaging more with other disciplines, including historians, anthropologists, and political scientists. This would challenge us, and they would have plenty of insights on social protection that we sometimes don't see, and vice versa. And gaining those diverse perspectives could be a precious guide as we navigate these uncertain times. I'm not sure if I have enough time for picking up on a couple of the questions, Ralph. Otherwise, I'll just pass the mic.
We have 5 more respondents to go. I've seen the interesting questions indeed, and it's a pity that we are very short on time for the discussion. And actually, but I thought it was interesting to give panelists also time to make their statements. I'd like to ask Armando now to come in and provide us a concluding statement. Thanks.
First of all, I would like to make 2 comments about the financing. 2 examples from Latin America that I think might be useful to bring into the general discussion. The first one is Argentina's decision to pass a wealth tax between 1% and 3% on the very, very rich in Argentina. I mean, this it's going to be hard to see how it works out in practice. Is a one-off. That was what Parliament said. But nonetheless, we have a lot of experience of situations like the pandemic, for example, the Second World War, where the taxes increase and stay increased after that. So they stay at the high level. You know, people, it makes sense to have a wealth tax in this situation. I just say though that there is no way in which a wealth tax would actually cover all the adverse effects of the pandemic. So it's just one of the approaches. The other example is from Colombia, and I'm really interesting. I really want to sell it to you. This is not a pandemic response, but it was there before the pandemic. The government decided to return some of the VAT receipts to people who are in poverty or who are vulnerable. I think that solves one of the big issues that we have in low and middle income countries, because our tax systems are not progressive. In fact, they take as much money from low income people as a proportion of their income from rich people. So it's unlikely that we're going to have an income tax of the type that allow the expansion of welfare states in European countries. So if we only have the VAT to work with, and it contributes something like 50% of revenue to governments in Latin America, and even more so in other countries, in other regions, then perhaps we need to really think about that and see how it works. So using the taxes, the VAT revenues to actually finance anti-poverty programs. And I think my 2 minutes are up. I don't know.
Thank you, Armando, and thanks for these interesting pointers. Lynette Mart, I'd like to invite to share some reflections and also ideas on the way forward. Lynette.
Okay, thank you very, very much, Rolf. I think I want to focus on 3 issues. The first one is there's often an embracing of the automation of the systems in which social protection are delivered. And yes, it's important to have those, but they do need to be tempered with a human face, and particularly in very, very poor areas where people do not know how to use a device, where people do not have interconnectivity, where people do not have data, things that are taken for granted by many. Those interfaces become really, really challenging and problematic. And the automated messages that are sent to people that they don't quite understand or can interpret or whatever needs to be dealt with as one go forward, specifically in the South African context. But there are also issues that one needs to learn in the global space as this gets rolled out. there's almost a lock, stock and barrel of taking everything on board with regards to automation without the necessary sensitivity. The second issue that I want to raise, and often that automation is also in English only, that excludes a whole lot of people. The second issue that I want to raise is around this question of the exclusion or the gender discrimination that often happens within the spaces. And the South African case is a good example where designs are taken into account. Women are associated with children, are put into households, and on the other hand, they are individuals. So there needs to be clear principles around which these things are designed. And so in the South African context, the Caregivers Grant are almost an anomaly in that it doesn't conform with the individual grant system that we have. But there's often confusion between individual on the one hand and households, and with households often come a whole lot of set of power dynamics that might not result in the delivery of the grant to a particular individual or the household. So designs taking into account very carefully gender and the impact that such a system would have on women. And then I think the third one is within South Africa, there is certainly from civil society, academia, and even people within political parties and the ruling parties, this passion to continue to have some kind of a protection in the form of 18 to 59s who have no income or little income. And there's almost a need to debunk some of these assumptions that we live in a world where there's full employment. We live in a world where there will be job security. We're living in the world where there's no casualization and almost kind of trying to shrink civil services, trying to shrink businesses so that it operates very meanly on automation. So that question is something that we need to probe just a little bit more deeper, and the impact of the fourth industrial revolution on the world's economy or local economies and also globally. Thank you very much, Rolf.
Thank you, Lynette, and very interesting aspects which you have added to the debate. Thank you. We'll move to Dr. Sania Nishtar for some concluding remarks. Dr. Nishtar, please.
Well, thank you for asking me. I think that post-COVID, there is a very deep and profound realization that we need to pay social protection a lot more attention than we have in the past. And I think that realization is fair and has cascaded very deeply into governments. The question is, how will that realization translate into action? Will governments give social protection due priority? Will governments commit the necessary resources, and where will the resources come from? Will they come from progressive taxation, or will they come from scaling back upon targeted subsidies? Will they come from higher allocation of revenues? Where will the resources come from? And then it is not just a question of resources, it's also a question of how you will execute programs well. Because just having a resource envelope, it doesn't answer all your problems. And I think the bulk of the issue is within the execution pipeline. I think that there is a profound realization that the principles are going to be fairly clear, whether you call it adaptive social protection or reactive social protection or responsive social protection, or whether you espouse universal basic income or universal social protection. Regardless of what you call it, we're basically talking about widening of the net, improving the coverage, improving, scaling it up vertically and horizontally. But the execution question will need to be addressed, and I think that It is here that social protection can benefit from some contemporary cutting-edge digital approaches that we have seen playing out in the pandemic, in the emergency response phase. And there are three. I'm reflecting a little bit on my own experience, and I think that there are three that we must draw on. The first is live systems of eligibility ascertainment. I think that in today's day and age, where the use of handheld devices is ubiquitous, where data portability is is so easy to ensure, we need to develop these live systems of verification of eligibility ascertainment, for lack of a better expression, these live ongoing surveys. That's number one. Number two, payment systems. All over the world, there is a transition towards faster payment systems. And these are the kind of infrastructure capabilities that the world of social protection per se is not aware of. But our central banks are involved in these transformations. The ministries of finance are involved in these transformations. And these fastest payment systems, spearheaded by central banks within countries, really can help accelerate the deployment of social protection programs and bringing agility and innovation and beneficiary empowerment, within this space. So the faster payment systems, which are digital in nature, which enable the use of wallets, is something that need to be looked at by our community. And I'm very happy to share how we in Pakistan are moving to faster payment systems as we scale up social protection horizontally and vertically. And I think that's the second nitty-gritty implementation piece that needs a lot more attention from a practical perspective. And thirdly, the use of big data analytics. Because in many countries, you have a lot of data streams which is sitting idle. So not all data is digitized and ready to use, but in Excel sheets, on ledgers and paper, we know who owns cars, we know who owns land, we know what taxes people are paying. And so we were able to combine these three things to create something fairly robust, something fairly dependable, and execute. And I think going forward, we need to look outside of our own silos for solutions that exist within the government system, and piecing them together for effective social protection systems is the answer, I feel.
Thank you very much, and very interesting indeed. And I couldn't agree more that obviously a digital backbone can help in the delivery of social protection, but also carry certain risks where we need to be aware of, so we can utilize the advantages and at the same time circumvent some of the pitfalls it might have. I can't help but advertising that under the USP 2030 initiative, the Universal Social Protection initiative, there is a initiative coming together to work on standard setting for digital social protection tools to make these interoperability and transitions better. So I call upon the technicians from Pakistan and all the other countries connected, as well as the agencies, to help and contribute to that convergence initiative and standard setting. That much as an advertisement break, and I'll hand over to Bessie Msusa for her concluding remarks. Bessie, please.
Yeah, thank you, moderator. In terms of lessons learned and how we want to move forward, we need a comprehensive shock responsive social protection system designed which should respond to any other shocks in the spirit of leaving no one behind. We have seen that in Malawi, we've taken long to respond to the COVID-19 horizontal expansion because of the systems were not in place. I cannot agree much in terms of digitization. We need to go digital in terms of payment systems. That will respond to the crisis in much timely manner. And again, we also have to go beyond the current ultra-poverty and social welfare thinking and looking beyond that poverty thinking. Instead, we should use poverty and vulnerability risk factors in terms of targeting. For Malawi, I think we should enhance the functionality of the Unified Beneficiary Registry. We really have a social registry which holds characteristics of households, but that's not at 100%. So we really need to enhance the functionality of that one, because if we had the social registry at 100%, we could have just looked into the social registry and target our beneficiary. So in terms of financing mechanism, yes, I think we have to look beyond what we are doing now in terms of going digital, as I've already said. So the support systems should be in place so that we should respond to the crisis, any other shock, in a timely manner. Thank you.
Super. Thanks for the very concise points, Bessie. And last but not least, this time, Francesca, for a very brief concluding statement from your side, please.
Thank you, Ralph, and thanks everyone for the really interesting thinking and inputs. Perhaps just two final thoughts. One is that as we continue to monitor and examine and directly also influence adjustments, as we're still very much in the midst of a crisis, I think there's still a lot to do. So in terms, and one of the things that this project in particular and the specific papers that will be released is doing is to look beyond some of the aggregates, or top line findings, to look specifically at particular population groups, who's in, who's out, how do levels of, adequacy, whether in terms of levels, comprehensive and so on, vary. And this is quite crucial because while we are hearing about, top line messages of how income support grants are in many countries containing poverty and playing a critical role, once you start to look more closely by population group, there are also very clear, in some cases, unfortunately, patterns of replication of exclusion, where some of the marginalized subgroups or more vulnerable subgroups within some of the population groups we were covering in this study continue to be disproportionately excluded. And given that there's been quite some talk about the potential around digitalization, absolutely, there's a huge potential. There's also a huge potential that this essentially replicates or even reinforces existing inequities. Lynette touched upon this, and in fact, we are finding this in some of the specific case studies we're looking at. So I think there's still a lot to be done to help ensure that as adjustments continue to be made, it's a constantly evolving picture, and then but also as we think through the wider picture of where we're headed, we continue to pay close attention to yes, the full picture, but also what's happening to particular groups that are at risk of exclusion and continue to be. They were before the crisis. We've seen some interesting, attempts to step up support or expansion, but there's still a lot, lots of question marks, both regarding the sort of operational nitty-gritty details of the implementation of schemes and then the wider picture. And just a point on this, again, the papers that you'll see as part of this study consider these various aspects by population group, and what is emerging is that for some groups in particular, we are seeing essentially a replication of some of the assumptions that are underpinning existing inequities in social protection. A key aspect of this, for instance, concerns gender. There's a gender paper by Rebecca Holmes and Abigail Hunt. And this also picks on some of the things that Lynette has been saying for the case of South Africa, where adjustments made very clearly continue to reflect an underpinning assumption about the gendered division of labor, particularly unpaid labor. So, all of this needs considerable, thinking and rethinking, both as we work around or on crisis response mechanisms, but also into the future. And talking about the future, I think there is a very strong positive aspect here, you know, crises are often a trigger of a sense of solidarity and renewed solidarity. And in some cases, we are seeing this here as well. We have heard a bit about some of this in some of the conversations today, and certainly we pick these up in our reports as well. A key question will be, how do we build on that? How do we harness that to help ensure that you know, we don't lose the opportunities that are being presented? And that involves critically bringing in the financing equation, bringing in the question of responsibilities of different players and different actors in a society, government, but also importantly, the private sector, employers, and everyone else, bringing them all to the table. Thank you.
Super, thank you, Francesca. And as you said, you know, many of these things can be read in more detail in the papers which are coming out in the next few weeks, or as well as podcasts to which we invite you to subscribe. So there should be a link posted in the chat as well, podcasts from ODI on these papers, as well as, you know, general social protection podcasts from sp.org and so on. So do subscribe. I you know, really thank the panel for their very rich discussion and the many contributions. I apologize, we were slightly pressed for time. We could easily go on for another hour, I guess. Discussion fell slightly short. I would seek the help of the panelists to maybe help answer some of the questions posed, at least by the audience, briefly in writing, and we would post them on the website to their webinar as well. There will be more webinars to come on these and related topics, so stay linked to sp.org. We will also be, from GIZ side, be organizing more webinars, and several in relation to the ODI papers coming out, and we'll be looking with partners on webinars on adaptive social protection, so there should be more room for discussions where we can delve deeper. And the very last but not least is to really thank ODI for the studies conducted and presenting them here, the panelists for the very rich contributions from your various perspectives, so that's really much appreciated, sp.org for hosting and organizing the webinar, colleagues from my team for supporting in that as well as you, the audience, for you know, staying throughout and engaging in the discussion with us. Thank you very much. I wish you a great rest of the day, wherever you are. Thank you and bye-bye.